Good afternoon, everyone. My name is Scott Spallina, President of the Senior Counsel Division of the Hawaii State Bar. Today is my pleasure to introduce our speaker for today's coffee hour, Tracey Wiltgen. I've known Tracey for many years. I first was introduced to her when I co-hosted a show called Today's Kupuna, and she's one of the guest speakers talking about the Kupuna Pono Program, an excellent program with the Mediation Center of the Pacific that helps people in transition of finding caregiving for their families. And Tracey also has been involved in the Mediation Center of the Pacific since 1993. And she has some stories, I'm sure she's going to tell us today, about the Mediation Center of the Pacific, some of the more difficult problems with dealing with mediation in a day of Zoom and a day of perhaps court-ordered mediation, not only in the family court, but also with tenant and landlord disputes, with interpersonal, with employment. It runs the gambit. Mediation Center of the Pacific is very helpful to not only people not in the court systems, but people in the court systems as well. One thing is I'm a volunteer mediator myself with the Mediation Center of the Pacific, and we explain to people that oftentimes judges don't have the opportunity to really dig deep into the problems that the Mediation Center can dig into. And so that's one of the responsibilities of the Mediation Center of the Pacific, is to help the judiciary make good decisions for their clients there. She's a graduate of William S. Richardson School of Law. She also has her degrees from Gonzaga and from the University of Hawaii. And with no further ado, I'm going to introduce Tracey to y'all. Thank you very much.
Thank you, Scott. Aloha, everyone. Thank you for being here today to learn about the Kupuna Pono Program. Let's see if I can make this work. Down arrow. Not working. No.
Here it comes.
Slight technical difficulty. We will overcome it very quickly. See, it wasn't me. I feel so much better.
Okay. Okay. There you go.
Ta-da. All right. So a little bit about the Mediation Center of the Pacific before I talk about the Kupuna Pono Program. So the Mediation Center of the Pacific has been serving Oahu's communities since 1979. So we were the first mediation organization in the state. We're a 501c3 nonprofit, and we serve over 15,000 people annually. So just a little bit, Scott touched on our programs, but we provide mediation in a broad array of areas. So Kupuna Pono, which is our focus today, and I'll be talking about civil rights, domestic, consumer merchant, employment, landlord-tenant, special education, and more. So we provide mediation in every area where there's conflict. And we refer to ourselves as MCP, Mediation Center of the Pacific. So our services in general lower community support costs, because when people are able to resolve their agreements through mediation, they don't need to spend more time in court. They save money. They don't need to access additional support services. It can reduce medical care expenses, particularly in the area of Kupuna Pono, but also when we help families or couples reach agreements and lower the stress, they're less likely to need additional medical care. Assurance of chronic disease management, focusing on Kupuna Pono. Additional community income, taxation revenue benefits from programs. Savings in housing and support costs for homeless families, such as in our landlord-tenant mediation program. And savings in community law enforcement, court system, and government agency costs. So working through mediation can save funds in a variety of arenas. For the Kupuna Pono program specifically, our goals are to clarify the needs and desires of the elder person, there who is important, and the development of a family plan to support the needs and care of the elder person. Common plan elements can be support for instrumental activities of daily living, such as housekeeping, shopping, finances. It could be support for activities of daily living, such as feeding, bathing, toileting, short and long-term living arrangements, even end-of-life decisions and preferences. So we cover a lot. So I think this is important when we talk about this program. You know, we plan for the early stages of life. It's really fun to talk about it, go out and shop for cribs and all the things, right? When we're starting a new life. But we don't like to talk about the elder part of life, the aging part. Let's just pretend that that's not happening. And yet we do need to talk about it, and that's important. And that's why we designed Kupuna Pono, to help families engage in these conversations about every aspect of aging. To talk and plan, the failure, we can't see the top, the failure to talk and plan is a recipe for conflict. And we know there's a lot of conflict around the care of an elder family member. So I like this saying because I think it really encompasses why this program is important. Clarifying expectations sometimes takes a great deal of courage, particularly when we're talking about end of life and aging and the things and losing independence and all these things that are tough. And it seems easier to act as though differences don't exist and to hope things will work out than it is to face the differences and work together to arrive at a mutually agreeable set of expectations. So for me, this really encapsulates the importance of this program. And one thing I didn't mention, I am stoppable. Please stop and ask questions. I'm gathering that everybody via Zoom has the ability to send questions and you're monitoring it. I'll leave time at the end, but I'm interruptible. And so I'm happy to address questions throughout. So just a few facts of why this program is important, in addition to my quote. Population is getting older. Living longer results in great challenges, physically and mentally. Dementia gets more common as we age. We don't like to know that, but it is a fact. Over 65 years, 3.5% of the population. Over 85 years, 40 to 50%. The cost of caregiving is financially and mentally draining, particularly here in the islands. And families aren't prepared for the mental, physical, and spiritual challenges of caregiving. And I know that for a fact because I was a caregiver for 16 years. I took care of both my parents. Never in my wildest dream, you know, of course, they're your parents and you love them and you're going to be there when they need you, but you don't anticipate what that's going to take of you personally, professionally, the amount of time. When I ended up moving in to take care of my mom because she had Alzheimer's, never in my wildest dreams that would I have thought that I would be taking care of her for the next 12 years. You don't think in terms of that. You just know they need my help and I'm going to help. And that's why really engaging in conversation early is so important. A little bit more facts. So Hawaii's elder population, 27% of Hawaii's population will be over 60 by 2030. The Hawaii life expectancy is higher than any other state. And we know people are living longer in other states, so they're really living longer here. Private nursing homes charge almost 50% more here than the Continental U.S. Hawaii home health care costs thousands of dollars more than the U.S. average. Most of Hawaii's elders rely on family members as caregivers, and one in three adults in Hawaii, age 45 to 70, care for an aging person in their home. And primarily, not to be discriminatory, but these come from the fact, primarily they're women. So the challenges of delivering elder care, family conflict is common in delivering elder care, and I'll talk about the issues. Family conflict results in lower care for the elder person, not to mention decreased quality of life for the caregiver themselves. I know a lot of caregivers who passed away before the person they were caring for because of the stress and the conflict. It can lead to elder abuse, poor physical and mental health of caregivers, and irreparably broken family relationships when you need those relationships more than ever. Lower quality of elder care results in increased physician visits, increased ER visits, increased readmission to the hospital, longer hospital stays, and increased need for medication. Thus, not only is there a human factor why it's important to address these issues, but there's also a financial factor, and we already know our hospitals and our medical arena are so full, it's hard to get in. And so if we can reduce the need for these hospital visits and emergency visits by helping families engage and work more effectively together, we're making an even greater impact. The Kupuna Pono is a program designed to help families talk about difficult issues and difficult transition plans to support elder family members. We have 3 key areas. We have a family conferencing process, which I'll talk more about, guardianship mediation, and then mediation in general. So the outcomes, irrespective of which process, is to preserve family relationships, maintain the dignity of the elder person. That's always key. Clarify the real issues and interests of the parties. It's not always about money. It's not always about, there's often very deeper underlying issues that create the conflict. Enhancing family communication and collaboration. Our job isn't to make people like each other, particularly if they never did, but it's to help them work together as a family unit to support their elder family member. Develop plans to share decision-making and caregiving responsibilities. Work with professionals and outside resources to create flexible, realistic plans, and gain an appreciation of each other's perspectives and concerns, because often it's very different. This is an underlying premise. This is the hard, I think for me, this is a really hard part about caring for an elder family member. It's balancing independence with safety. You want to make sure your loved one is safe, but sometimes we go overboard and trying to be overprotective when that person really wants more independence. And so balancing those things can be a challenge. And that's why having these conversations are so important. Okay, what am I doing that, oh, there we go. Okay. Guiding values to all the process. It's respect. Respect for the family culture. So as a mediator or facilitator, I might work with a family who operates really different from my family. And we need to respect how they operate. So it's not about what I think they should be doing, but it's how do you operate together as a family? What works for you? What's your culture? And I'm going to respect that. Self-determination. And that's on 2 levels. It's self-determination of the elder person, what's important to them, and making sure they have a voice. And self-determination on the part of the family that they're making their own decisions together. And that's a core premise of mediation in general, and why I believe it's such a powerful process. Empowerment, that's empowering families to have these conversations. Many families are busy, so they don't have time to engage, or maybe this is the first time. And so it is empowering them to have conversations and come up with their own decisions. Informed consent, making sure they have the information they need. So part of it is encouraging to go out and get resources that are available. There's so many resources out there, but oftentimes people aren't aware of them, or maybe they haven't accessed them, or they don't know where they are. Confidentiality, we're respecting the family's conversation. So in confidentiality and mediation, it's always about, I don't go out and talk about anything I've heard. If you do end up in court, and let's hope you don't as a family, but some families do, that those discussions and mediations or offers can't be used in a formal legal proceeding. Confidentiality in a family conference, that I don't share this information with anybody else except your family, unless they give us permission to share with the elder person's physician or social worker, which sometimes that may be the case. Impartiality. So I'm not there to take sides, even though sometimes maybe I might feel sorry for the elder person and I might want to be a champion for them. That's not my job as a mediator or facilitator. Or I might feel sorry for the caregiver. But we are impartial. We're not taking sides. We're not telling people what to do. We're not championing one person over another. We're helping them engage in conversation, get the resources they need, come up with the agreements and plans that work for them and their family. So areas for discussion and decision-making. And as I said, it's really, really broad. It could be medical care, living options, safety, home repair and maintenance, eating and food preparation, support and caregiving, socialization, healthcare and financial decisions, financial resources, even end-of-life care, even funeral arrangements. We have had those conversations in some of our family conferences. There's many areas of potential conflict, but the key areas is quality of care. I don't think my brother's taking effective care of mom, so he shouldn't be the caregiver anymore. Finances, I think my sister is spending all the money and it's not being spent on mom. Decision-making, I don't think you're making good decisions, or I want to be part of the decision-making. I want to understand dad's medical condition and I want you to be sharing it. And personal relationships. You know, mom always loved you better. And that's why she'd always treated you better, but yet I'm the caregiver. So we go the gamut, and it covers everything from the legal to the healthcare to the personal issues. Then there's a lot of underlying issues. It could be different values and expectations of family members, unreasonable expectation, different roles and responsibilities. It's really hard too, especially in the islands where one sibling or maybe two siblings live here, another lives on a neighbor island, or maybe the mainland, or maybe some other country. And yet they want to be involved, but they don't know how, or they feel guilty, or there's resentment on the part of the one who's here doing the primary work. There's confusion about the laws and things that govern this area. We often hear the confusion about, oh, well, we all want to make decisions and we don't like the decision brother's making. Okay, but brother has the power of attorney appointed by your mother to make healthcare or financial decisions. And so that's not something that you can suddenly change on your own or a group decision. So confusion, frustration. It's hard work being a caregiver, and it's no fun being cared for when you're an independent person and you don't want your grown-up kids telling you what to do. Personality clashes, blame and guilt, changing roles, changing from I was the daughter to now I'm taking care of you. That's a tough switch. Changing lifestyles, loss of control, uneven division of labor, family history, different levels of acceptance. Yeah.
Typically, when does a family go to the Kupuna Pono program? Is it maybe when someone suffers, like the elder suffers an illness, or maybe the primary caregiver, let's say the daughter is tired of being the caregiver? And what, in your experience, have you seen when families actually go to you guys?
That's a great question. So I'm going to tell you my experience when they've come, and I'm also going to tell you when they should come. Okay. So generally, when they come is when there's a conflict and there's something not going right. And we have worked closely with a lot of the healthcare institutions, in particular, when we first started the program back in 2015, 16, we worked very closely with Kaiser Permanente. Their leadership at the time recognized the value of the program, and we educated the social workers, the geriatricians about the program, because what will happen is they see the family conflict. So the elder person is their patient, but next thing you know, you've got the siblings who aren't getting along, and the last doctors don't have time to be in the middle of a family conflict, much less the social workers. And so they would be referring families to us. So it's families who are already struggling, already in conflict regarding the care of their elder person. As we promoted the program and got involved with a lot of other organizations, the Alzheimer's Association, Catholic Charities and their elder program, we started seeing elders being proactive. And I said, this is great. We want our kids to know how we want to be cared for and what we want them to be involved in and not involved in. And we would like to initiate this family conference. So that's awesome. What we have told physicians, healthcare facilities that we reach out with and partner with is, as soon as there's an issue, families should be referred to participate in a family conference. So you have an elderly mom who's living on her own and doing really well. And next thing you know, she falls, she breaks her hip, she's in the hospital. Now she's gonna go to rehab, and everybody recognizes, she can't go home immediately and be on her own. Maybe ultimately, it's a time to have a conversation about what support can we provide now? Maybe what support should we be looking at in the future? It also sets a culture for the family coming together to have these conversations. So that's where the ideal is. Before there's all this family conflict and they're in a crisis. So some of the cases initially would be called the families in the hospital. So there was one mom is going in for open heart surgery. She could possibly pass away. She's the matriarch. She takes care of everybody. She's not gonna be able to take care of everybody in the hospital. There we came and did a family conference. And this was also a good example about a different family culture. So this is a family who generally didn't have conversations. Everybody was busy. The main daughter was always out working because she had two lively twins. And I know they were lively because they were actually there in the family conference because there was nobody to babysit, right? So we had, because grandma was usually the primary caretaker of the two little boys. And then you had dad, who they were not a married couple, but had been together for years. He had a lot of his own health issues, relied on her. So he couldn't become the caretaker of her when she came home, much less take care of two little boys. So her sister grabs brother, who had some drug addiction issues, off the street and says, you need to clean up because you need to help family. Now we have this family who's going, they're all talking over each other. But for them, asking questions and going through this process and having mom have a voice, because what mom really wanted, she goes, I really just want to go to a rehab and kind of, get well and be able to come back and see my grandkids, as opposed to all of you trying to figure out how you're going to help take care of me back home. And they thought the best thing for her was to come home. But when she was able to express that was really what she wanted, not that she didn't love them, but she loved them enough. She felt that was a better way for her to get well, to be able to come back and be a vital part of that family. So that worked. But wouldn't it have been better to have that conversation? I'm glad that conversation worked, but to have the conversation a lot earlier before things got so dire. So great question. So the earlier the better. And with most families, what we find when they go through a family conference process, they learn a different way of communicating with each other. It's kind of a process, and they can do it again on their own. I mean, some people will come back a year later, 2 years later to update their family plan, but others, now they can do it on their own. And that family that I described, at the end, they said, oh, this was great because we never take time to talk to each other as a family. We talk to each other and we're making decisions like one or two of us or three of us, but not as a whole family. And that they found it really valuable, and they said, we'll do it again. And so they were able to continue and do it on their own. So the sooner the better. It sets up a structure for them to communicate with each other. It also puts plans in place for when things become a crisis and then everybody wants to make quick decisions. So lots of control, uneven division of labor, different levels of acceptance. And what I mean by that is oftentimes this is with, there's a sibling who's the caregiver physically present here on the island. So they see mom or dad, auntie or uncle, whoever it is, on a daily basis and see the decline for what they can't do. Whereas the sibling who's on the neighbor island or on the mainland, who isn't seeing the parent or the elder person all the time and talks to them on the phone, or maybe even sees them on Zoom, said, mom's not that bad. And she tells me she's fine. So I don't know why you're so worried about doing all these things for her. So they see them in a very different place, and they don't understand why each reality is different. And there's very different perspectives. So just a couple slides that reinforce that. So certainly one of the very real fears felt by anyone with Alzheimer's disease is the fear of failure. I live with the imminent dread that one mistake in my daily life will mean another freedom will be taken from me. So the perspective of an elder person, you know, just because somebody is diagnosed with Alzheimer's or dementia doesn't suddenly mean they can't be independent, they can't do things for themselves, but sometimes family members, especially well-meaning and loving adult kids who are busy with their own lives, suddenly, oh, well, we need to move mom into a care home. And it's like, well, why? You know, or mom can't participate because she's got Alzheimer's. Well, what stage is she at? So the people, the elder people that are being supported by these plans have their own fears and concerns. And then you have the opposite side. So just a short comic, you know. So, well, let's see what her mood level is today. So well-meaning kids coming over, never knowing who they're going to be dealing with. So it's hard for everyone. And last one, we will talk about it. I will listen, but you must talk with me about it so that I can make an informed decision. It's my decision. And so many times when we've had adult siblings contact MCP, either for a mediation or for a family conference, oh, it's about mom or dad. Okay, so mom or dad, whoever it is, let's say it's dad is going to participate. No, they can't participate. Oh, well, why not? Well, because they've got Alzheimer's or they've got dementia. Oh, okay, well, what phase are they at? Well, maybe they could participate for a little while. So our focus is to make sure that that elder person participates. So we've had done family conferences at a care facility. And these two siblings, one within the mainland, one was locally, person in the mainland flew over, and they both said mom and dad can't participate because they have Alzheimer's. And we said, what stage are they at? Well, dad is not too bad, but mom is really bad. Okay, well, maybe she could participate for some of it. What's her best time of day? Well, I guess in the afternoon before dinner, she's more alert. Okay, can we hold a family conference at the care facility where both mom and dad were living? Well, I guess we could check. Care facility says yes. So we said, okay, let's set it up an hour before dinner time and have them participate, and we can continue with just the two siblings if mom and dad are okay with that, or if we need to schedule another time with them. It was like, well, okay. So when we have the family conference, dad was pretty alert, you know, he was fine, you know, followed everything. Mom, on the other hand, came in and she comes in with the walker, looking down the whole time, looking pretty disheveled. So she definitely looked like she's probably not following things. But part of our job is to make sure we're inclusive. You know, how do you feel about that, Mr. So-and-so? You know, yeah, I'm fine. And one of the issues was the daughter was going to be moving to a different state, wanted to take parents with her. Son wanted to move parents to the state he was living in. Nobody had asked the parents what they wanted. So as we're having this discussion about where the parents should live and ask the dad, and he's like, you know, I'm fine staying here. I'm okay here. I like it here, but I'm okay moving with my daughter. And it was like, okay. Then looking to mom, who didn't seem like she'd been following. So what do you think, Mrs. So-and-so? Where would you like to live? And she looked up. She says, I just want my kids to stop fighting. So it was a very important moment in that family conference because the kids realized, okay, one, we shouldn't be doing this, and we should be respecting and asking them, even if the participation is limited. So we asked the parents if we could continue, if it was okay to continue the discussion. They were going to go to dinner with just their kids, and they agreed. But before they left, mom said, I'm okay living with either of my children. I don't want them to fight. So it's important. And that's part of this process, is it's getting everybody involved in the conversation, and that's how it should be. So I want to distinguish the processes. So mediation, it helps participants in conflict to talk and negotiate solutions. Confidential, as I mentioned, it focuses solely on the issues in conflict. So you identify what are the issues in conflict. My sister and I disagree about her living in the house with mom. I think that she shouldn't be living there. My brother and I disagree about how he's handling the finances. I feel like he's not being transparent and he's not spending all the money on mom or dad, whatever it is. And you negotiate agreements that meet their needs and interests. So in general, the mediation process, there's a lot of different styles and approaches to mediation. The convening portion of the mediation is that setting up of it at the Mediation Center of the Pacific and the community mediation centers across the state. We have staff who do the convening. So it's the staff who talk to each person, determine who needs to participate in the mediation process, determines when it's going to be scheduled, day and time, and of course the platform nowadays. Is it via Zoom? Is it going to be in person? Where is it going to be held? Private mediators will do their own convening and they spend more time talking to the people up front, but typically this is done by the staff. Then once it is scheduled and it occurs, you have an opening. Now, typically mediations, the opening starts with everybody together in the room, whether it's a virtual room or whether it's a physical room, the parties and the mediator together. Then once the mediator lays the foundation for the process, the mediator will find out what are the issues that each person wants to work on, or maybe what they want to accomplish in mediation. And then it's moving into private session with the mediator going back and forth between the parties in private session. That gives the mediator the opportunity to gather information, hear each person's perspective privately, still in private sessions, going back and forth, negotiating potential solutions. Ideally, if there's an agreement, bringing them together to write up the agreement. Now, I say ideally, if people are in deep conflict, they may not be comfortable being in the same room together. So it may be a lot of private sessions. Now, the interesting thing about this, and that's typical, particularly if they're represented by attorneys and they're already deep in conflict, generally it's private session. But to encourage families to have conversation, the more they're together in a joint session, the more that will help them be able to more effectively communicate with one another. So it's a good process for addressing specific conflict. It's not necessarily the ideal process for helping people to communicate more with each other, unless they're going to spend a lot more time in a private session, but that's just in general. And that's part of why we created the family conferencing process, because it's really about helping the family members talk to each other, engage with each other, and develop plans together so that they are working more collaboratively together to support the elder person. So the process is different from mediation. Underlying principles is that families have strength. So that strength can be tapped for positive change. And strength help resolve issues and concerns, and strength are enhanced when they're acknowledged. Families have the keys to their own stories, and families are capable of making their own decision. So this process was based on the family conferencing process that's used by Ethical HANA that focuses on families caring for children. So with Ethical HANA, if the parents of a child are deemed not appropriate to be parents anymore, the child runs the risk of becoming part of the child welfare system. So they go through a family conferencing process where extended family members come together with a process similar to what I'm going to describe. And so we said, if that works for families and their children, it can work with families and their kupuna. And so that's how this process was developed. The benefits is it enhances family members' decision-making abilities to work together. It builds a cooperative relationship, which is what the elder person needs, not a family that's fighting. And it assists the family within the context of their own culture, and families become more self-determined, and it provides a safe environment for information sharing. And I'll share a couple stories. But family plans should be updated at all stages, and it goes back to when should somebody create a family plan? Well, first you have a vulnerable kupuna. Maybe they're living by themselves. Oftentimes what happens is they're living with one of the adult siblings. So it just happens to be the one that never quite found themselves. Everybody else is busy working with their families. This one never quite found themselves, so they end up living with mom or dad, which works really well initially because the rest of the siblings are like, great, mom's got company. That's if something happens, we know brother will call us or sister will let us know. But then as the kupuna starts having greater needs, that adult sibling who never found themselves isn't able to step up to meet those needs. Well, I don't cook. I can't start cooking for mom. Mom always cooked for me. I can't, I'm not capable of doing that. Or I'm not gonna go buy the groceries, or no, I don't clean house, or whatever it is, all the things that the older person needs help with. So then it becomes, oh, wait a minute, we need to have a family conversation about how we're gonna address these needs. And they identify the strengths of the family and the kupuna, and I'll talk about how we do that. The concerns, resources, and an action plan. And then as the kupuna's needs become greater, you know, whether it's every 6 months or a year, the family can determine that. They come together and they update the plan once they have it in place. So the key to family conferencing is pre-planning. In mediation, we don't come up with a detailed agreement before we enter the mediation process. So you have an understanding of what the issues are, even if you're a private mediator and you're getting pre-mediation statements, you're still spending more time in that process. It's a more fluid process going back and forth. Identifying issues, discussing the issues, and negotiating agreements specifically on the issues in conflict. Whereas in family conferencing, every person who's going to participate speaks with, what we call them, our client service specialist, who's like a case manager, and finds out, you know, what are your concerns about your kupuna? So maybe one sibling says, I'm worried about mom living in that house. You know, the house is falling apart. She shouldn't be living there anymore. And I really think she should be moving into assisted living because she's going to fall down the steps and break her hip. And that's my worst nightmare. Okay, the next one is, mom's really independent, loves living in her house, and I wish my sister would quit telling her that she needs to move into assisted living. And what I think mom really needs is a dog to keep her company, because she's always wanted a dog. So I think that's what's important for her. And then you get the brother who says, you know, both my sisters don't know what they're talking about. What I think mom needs to do is move in with Auntie Belle, because Auntie Belle is older too, and they really are close and they work out really well. So now I know, okay, each one is a little bit different. I'm also, as a client service specialist, assessing who gets along with each other, who doesn't. So the facilitators have an awareness of what they're walking into and how to manage the family dynamics. And also, okay, it sounds like it's focusing on living arrangements, possibly socialization, what other needs. They also, the client service specialist finds out what is the diagnosis? You know, has there been a recent diagnosis? Because you'll have one sibling say, mom's fine. And another one will say, well, no, mom's got dementia. She can't remember anything or do anything for herself. Well, is there a current diagnosis? What did the doctor recommend? What's been recommended? Maybe even encouraging them if there's a real difference in the level of understanding of the elder person's need, to encourage them to get a medical evaluation before they participate in the process so that everybody can be on the same page. And also to get recommendations of what else needs to occur. So we identify all these issues and then based on the issues, create an agenda in advance. So the phase the family is at, we also ask in advance, is there a power of attorney to make financial decisions? Is there a power of attorney to make medical decisions? Who has that power of attorney? Have you had this discussion? So they may not know at all. They may say, oh yeah, I know mom said, a long time ago that she and dad went and they did a will, but I've never seen it. Is that something you want to talk about before coming in, or gather that information before coming in? What resources have they accessed? So some families haven't accessed anything. Others have used various resources. And what resources do they need to access first? And learn a little bit about the family culture. So as I mentioned, when we haven't been doing this because obviously things changed a lot during COVID. So we weren't going out and meeting families wherever they were at. But that was initially and ideally what we will go back to. It's not always convenient for a family. Not every family is comfortable meeting via Zoom. And that, doesn't create the best communication atmosphere, but thank goodness we have Zoom, particularly for family members who aren't here physically. But it's not always convenient to meet at the Mediation Center of the Pacific, even though we have a lovely large room where we can conduct a family conference, and it's pretty convenient because it's on Young Street. But if everybody lives in Waianae, they don't want to drive all into town. So if we can meet them in their own community and have a place, we won't do it at their home. But if we partner with groups within the community. So sometimes it was, at a medical center, like Waianae Post Comprehensive. Originally, when we started the program, we had a partnership with them. So they had a room that they could let us use. And so places like that. So that we can make it as comfortable as possible for the family and fit within their community and culture. So everybody participates. Once in a while, we might have a sibling who says, I'm not going to do that. And then it becomes, is this person critical? Are they the decision maker? If they have the power of attorney and they don't want to participate, then we're not going to hold that. But if they're not the key decision maker, or maybe they aren't heavily involved in the caregiving, we can still have that family conference. It's okay. And sometimes that actually later encourages that person to participate. Sometimes it's important during the family conference to let families have private time, because really, again, it's about them and their decisions and what's right for their family. We capture a group memory, and we don't do it electronically. Like what family has a family meeting and somebody's typing up on their laptop or their iPad? So we, again, stick to the old style. We have the old style flip chart and paper. We have co-facilitators, and one is capturing, and what we're capturing are strengths, concerns, needed resources, and the plan. So it's not like minutes, it's not like a typical, it's just those key things. During the conference, obviously, we have introductions and how do you want to be reviewed? We describe the process, we review the agenda, we have ground rules. Here's what's critical. Then we go, every single agenda has this. Each person provides an adjective describing what makes their family unique. So I remember the first time we had a family conference, we're out in, it was some park out in the back of Waianae. It wasn't even really a park, it was a field, but they had tents and things they set up. That, okay, if everybody would give me one adjective that describes, that makes your family unique, and they're looking at me like, are you nuts? But they went along, okay, we'll go along with this lady. And so the first one says, well, we don't really get along, but when it comes to mom, we're all there. Oh, okay. And yeah, we don't talk much, but we do really love each other. And if we need each other, we're there. Okay, so we went around and we captured that on the flip chart. Then the next is each family member provides an adjective that describes the elder person. Give me an adjective that describes mom. Oh, she's really independent. She's a fighter. She's so stubborn. She really loves us. She's our matriarch. She's our champion. Okay, we capture all that. The elder person provides an adjective that describes their children, if they're able to participate. And then we also ask the elder person, what's important to you? I want to be independent. I want to be in my house, whatever it is. I don't want my kids to fight. We capture that. The answers to those three questions, now we have them on our flip chart paper and they get stuck on the wall, like old flip chart, sticky paper way. But when the family is then engaging in difficult discussions to reach agreements together, it's not about what you think or what you think. It's how does it fall within what's important to your mom? How does that fall within what's important for your family? And so it goes back and provides a framework for decision making. So it's no longer, oh, you were always the favorite kid, or mom always capitulated to you. Well, you don't know what you're talking about. Those are the guiding factors, obviously, including the needs. There's medical needs of that elder person. And then we move through the agenda items, and generally it focuses on medication management, any changes that need to be made in the house to help the elder person navigate, socialization, dressing, depending on where that person is at, all the way to, even if it's not on their agenda, you know, if they're having a productive conversation, do you want to talk about end of life issues? Some of them have talked about funeral arrangement. And I'll give you an example. There was a family and it was very difficult for them to engage in this process because they were very private. And it's, you know, it's really a privilege as an outside stranger to be participating in somebody's family conversation about very delicate issues. And so mom had an interpreter and she just didn't want to talk. And it was 3 siblings, brother and 2 sisters. One sister lived on Neighbor Island, one here. They were the primary caregivers and brother helped when he could. But so it was really a battle between the 2 sisters. Mom had Alzheimer's. Sisters were having mom going back and forth between Neighbor Island and Oahu. And it worked until she started declining. And people with Alzheimer's need stability. They need a more structured environment. So it was making it worse for her, but the siblings hadn't done any research on Alzheimer's. They loved mom and they thought they were doing the best thing. So mom started getting more paranoid. So when she would be at sister's house on Neighbor Island, she would tell her, I don't want to go back because, you know, she doesn't let me out of my room. And it's like, what? Oh, well, then I'm not letting you go back there. And then so this sister is really mad. So now they're mad at each other and then they start accusing each other of things. But by going through this process, they could have a better understanding of what was going on that actually then, because it opened up communication, they finally had a better understanding of what was going on and they could reach an agreement to meet the needs of the mother where she would live with the sister here and the other one would come and visit, that they could actually talk about funeral arrangements and things like that, that then it was so far from their ability to have that conversation, but allow them to do that. There may be other issues that weren't on the agenda that come up. We'll put them in a parking lot and go back to them. Identify who is responsible for each action step. Okay, so you're telling me that the house, there's a lot of safety concerns. You've all agreed. We've talked about the resource and we give them resources where somebody will come in and do an assessment of what's needed to make the house safer, whether it's putting in grab bars or moving furniture or so it's easier to navigate. And Bill, you said that you would follow up with this agency. When do you think you can do that? And so then it goes on who is going to be doing it. So Bill, within the next 2 weeks, is going to reach out to this organization and arrange to have somebody come and evaluate the house to determine what needs to happen. Then Mary, you talked about that you're going to take mom for an updated medical evaluation, and then you're going to be sharing that outcome with the rest of your siblings, and you're going to do a Zoom call. So now we're creating specific action steps to meet the needs of the elder person and identifying who's going to do them and coming up with a plan. If there are conflicts and unresolved issues, how they'll be addressed, and encouraging family to agree on a future date to review the plan. now that you have a plan in place, and we type it up and send it out to them, so we don't just give it to them like a mediated agreement at the end. We take everything off of the flip chart paper, it gets typed into a comprehensive plan, and every family member gets it. And if they're working with a physician or a social worker and they want the physician or social worker to have a copy of it, we provide that. We will only do that with, obviously, with their permission.
Can I ask a
Yes.
question? So how do you, if the elder has dementia of
Mhm.
some degree, how do you assure that that person who's the object of the whole discussion is actually able to get across some of their likes or dislikes? Or, I mean, is there an advocate that you assign to them, or do you bring in their doctor? I mean, how do you do that?
Yeah, so that's a really good question. I mean, we're not specialists, so we're not assessing their competency, and abilities. We include them in the process by asking them questions, giving them the opportunity to give their input or feedback. In some instances, we have had a social worker accompany the elder person in the process, and we certainly would encourage that if that's something that the elder person wants or the family would feel helpful. But as long as everybody's focused on the needs of the elder person, we're given the opportunity to participate. That's
Well,
the
what
extent.
about neurological assessment of the subject before coming to family?
So we can't require somebody to do that, if there hasn't been a medical evaluation, we encourage that to happen. Especially if all of the siblings or whoever's there to support the elder person are in very different pages of what they need. So we would encourage that and ask for the evaluation. If there is a question about, so let's say the elder person is still managing their own finances, or maybe they are making decisions that seem dangerous to their health. And nobody has power of attorney to make healthcare or financial decisions for that person. So it may be that, they don't have the ability to just do that, but maybe that person needs to have an evaluation. Maybe they need to go talk to a lawyer about the implications of that. So we refer them out to attorneys, to physicians, to other resources. We would not require somebody to have an evaluation regarding their competency to handle their own affairs. We can encourage that, but we wouldn't require that.
But it would be helpful for the process.
Sure.
For the person such as yourself to understand the mental capability of the individual.
Yeah.
Because I mean, that's what self-determination is, right? I mean.
Yes, you are correct. If an elder person, let's say the elder person is going, no, no, my kids aren't making any decisions for me. I'm gonna be living in my house, and if you guys think you're gonna make decisions, forget it. And the kids are expressing their concern about the safety and capacity, then we would not continue the family conference to help them make, obviously, we can't allow the kids to make decisions for this person. And if this person doesn't want to have decisions made for them, but they may need to get referred out. Yes, Scott. Time. Okay, yeah, that's what so just a quick wrap up, but these are good questions, and these are things that we look at. If we think there's a potential for elder abuse, we do refer to Adult Protective Services. We did a 3-year pilot with Kaiser. We integrated the Kupuna Pono Program into their complex care. And so we had regular referrals at the time. This was a while ago, and the pilot results is 131 families engaged in family conferencing. 100% of the family conferences resulted in a mutually agreed plan, and 60% of the mediations resulted in a written agreement. So pilot surveys, the families felt that it was a very helpful process. We did a 3-month follow-up and 75% said it helped their families talk about issues not previously discussed. So there were good outcomes. So this is my last slide. And if there are any other questions, I know we have about 5 minutes. So again, it helps family members gain an appreciation of each other's perspective, preserves family relationships, maintains the dignity of the elder person, clarifies the real issues and interests, enhances family communication, and develops plans to share decision-making and caregiving responsibility. So I'm happy to address other questions. Yes,
That
Scott?
seems to be a very specialized mediation.
Yeah.
Are your mediators trained in looking at these issues?
Good.
And if someone wanted to, how would they be able to mediate for the Mediation Center?
Very good question. So, yes, this is a highly specialized area. So the people that we use in this arena, initially they had to be experienced mediators who had background in elder law or elder issues. So either the legal background, the social work background, or other similar backgrounds so that they were familiar. Our ideal team is pairing somebody with the legal knowledge with somebody with the social work type of a background. We currently, as we've been reinvigorating the program since we didn't highly promote it during COVID, we still would get cases and we still get cases, but we weren't promoting it like we were before, and we don't have the working relation. Well, we still get cases from Kaiser, but we don't have that steady stream that we did. But we now target recruit people. So our current, we have some that have been facilitating in this arena for a long time, so they're very experienced. But the people that we more recently recruited, attorneys who practice elder law, nurse practitioners, social worker who handles gerontology issues, experienced mediator who handled guardianship issues. So very specialized because it takes multiple skills. You need good mediation skills, but you also need good facilitation skills when you're working with larger groups. And so some mediators are great with 2 people, but put them in a room with multiple people and that could be a scary thing. So that's a different skill set. And then working with human and family dynamics. So if you're interested, we just finished a training in this. So we aren't taking new people right now. But I would encourage people who are interested to go through our basic mediation training, which happens twice a year. And the next one is in October. You can go to our website and get the information. And then let us know. I'm really interested in the Kupuna Pono program. And then when we offer the specialized training again, which is a 2-day training, we'd be happy to include you. And we are planning to do another one. I don't know if we'll schedule one for this year, or maybe early next year. We'll see about the volume of referrals now that we're ramping up again. Yeah.
I was wondering, what is the wait time? If I referred someone to get a case at a conference, how long would it take?
Generally, we can schedule it within 2 weeks, as long as the family is responsive. Yeah, that's the key. Yeah.
Do you have a question, Scott? Oh, yeah, Tracy. One of the terms that you used a couple of slides back was use a parking lot.
Mhm.
Does that just mean talk with one party or one faction in the absence of the other one?
No, a parking lot is where, you had an issue that really wasn't on the agenda that doesn't have anything to do with the conversation right now. So I'm gonna write it up here like, yeah, and I wanted to talk about my sister's car that she drives, mom, I think it's a dangerous car. Okay, so I'm gonna put that in the parking lot, and before the end of the session, I'm gonna go back and, okay, we have about 15 more minutes. Did you want to talk about this issue? Or we don't have enough time left. What do you want to do about this issue? Do you want to come back? Or is that something you can discuss on your own?
Okay, so you don't send somebody to the park.
No. Thank you for asking. A term of art.
And we got one question in the Q&A function. This person said cost. I'm assuming This is like, I guess, like the cost of, the service.
Oh, okay.
Yeah.
So, right now, we're funding it with, grants and donations. So if the elder person is in a lower economic, we'll waive the fee. Otherwise, it's a flat family fee of $250. So it's very affordable. Yeah. And that's our goal. Our ultimate goal is to have it be a covered service and healthcare plans, but that's a longer term goal. Yeah.
Do you generally does it generally just require one family conferencing or two or three or?
Generally, it's one, so we schedule it for 3 hours and it's generally one. Sometimes families want to come back. Maybe they didn't finish everything and they felt it was useful, so they'll come back. Others will come back like a year later and some never come back again because they go, okay, we can do this again. But most of them, it's a 1 3-hour session and the families are 3 hours and then it goes by really fast. Yeah. Yeah, but they certainly are welcome if they found it valuable and it's productive, they're welcome to come back. So we have one family that I think they participated 3 times and initially there was a gap of about 6 months between the first time and the second time. But then the second time, they felt like they hadn't finished everything. So it was just like, you know, within a few weeks later, they came back to finish up. But others, it's like one, yeah. It's up to them. Great. Well, thank you, everyone. I appreciate your time.
Yeah, you can give your closing remarks.
Okay, thank you again, Tracy, for a very interesting, presentation here. Our next, coffee hour will be on May 2nd. We'll have Terry Revere talking about condominium law, HOAs, tenants' rights, all that good stuff there. Just so everybody's aware, today's presentation, can be found on YouTube. It'll be uploaded at a later date. And so you'll be able to, not only watch, Tracy again, if you had any questions, you can review her presentation, but also, all of our other prior presentations on YouTube as well. The best way to look for that is just Senior Council Division Coffee Hours, and it'll come right up there. And again, thank you very much, Tracy, for your